We are committed to raising awareness and really disseminating these messages of safe healthcare delivery, infection prevention, and antibiotic use and stewardship to the long-term care community, and touch all of the different clinical professional organizations that have a role. For example, in nursing homes, you don't have physicians on site 24/7. So the frontline nursing staff have a critical role in the evaluation of residents and the communication of a change in status to a provider who might be off-site. Bridging and improving that communication pathway between that frontline staff member and the prescriber who will make a decision about initiating antibiotics is an incredibly important piece of ensuring appropriate decision making. And when you have to rely on somebody else's evaluation to make a clinical judgment, I think physicians have to have a lot of trust in those frontline nurses. So we engage with the professional organizations like the National Association of Directors of Nursing and Long-Term Care, who represent the clinical nursing leadership in these facilities, to talk about their role in bringing education to the frontline nursing staff. We talk with AMDA, Society for Post-Acute and Long-Term Care Medicine members, who represent the medical directors and the physicians who provide care in long-term care settings, so they recognize their opportunity as leaders in setting practice standards, but also as providers who implement that day-to-day best care, evidence-based use of antibiotics. We also have engaged the American Society for Consultant Pharmacists because, again, we know that pharmacies and clinical pharmacists are powerful partners in addressing medication use and improving safety of medications, and they also often have the data to help us understand how our prescribing practices are currently and where those opportunities for improvement might be. Sure, so I think you have to start back with the executive order and the national action plan that came out on combating antimicrobial resistant bacteria. And that really created the momentum that we've seen in talking about stewardship across healthcare settings. And something I really appreciated about that action plan was long-term care providers were specifically included in the strategy, that policymakers recognized that we couldn't just focus on hospitals anymore. We had to look at outpatient settings. We had to look at long-term care as well. In June, the White House convened a forum of stakeholders, bringing both the human health care and the animal health partners together to talk about antibiotic stewardship. And again, it was very exciting to see specific representatives from long-term care also have a voice and be able to educate their colleagues about how stewardship may be implemented in a different way. Just educating colleagues about the shifting care delivery in long-term care, I think, was a very valuable piece of the panel of long-term care experts that presented at that forum. And then in July of this year, the Centers for Medicare and Medicaid Services actually released new proposed regulatory requirements for long-term care facilities. That was posted in the Federal Register for public comment, and I believe it's still open for a little bit longer. This was a massive overhaul in the operations of nursing homes that receive federal monies like Medicare or Medicaid funding. And so one large piece was around infection prevention and antibiotic stewardship. And there's some very intentional language in those proposed regulations that incorporate monitoring of antibiotic use, development of protocols to guide antibiotic use, in addition to having an infection prevention staff person who has some training above their baseline clinical credential. These are pretty radical changes for nursing homes. I think it's going to be very important for us to think about the implementation of this regulatory language and how to help facilities really meet those expectations. But it does coincide fortuitously, I guess, with the other guidance and messaging that's come out recently about stewardship in long-term care. Thank you for the opportunity to talk to you, and also to encourage my colleagues in the infection prevention, healthcare epidemiology, and infectious disease world to continue looking at opportunities they may have to engage in long-term care, infection prevention, and stewardship. The coordinated approach across all healthcare settings, from hospitals to nursing homes to even home health agencies. The more we work together to address these problems that are facing our patients and our communities, the more success we're going to have.